Let's talk about failed implants. It's kind of a knee-jerk thing now when somebody's missing a tooth, put in an implant. Well, there's things to consider. I often don't like to put implants next to each other, especially if they're close to each other. In the aesthetic zone, the maxillary anterior teeth have to be really thought through carefully. Because if somebody has a high lip line when they smile, that means they show the entire tooth and part of the gingival tissue. Just getting an implant to osseointegrate doesn't mean it's a successful case. Other things can happen. These are cases that came into my office that had implants here and here. I'm not sure what happened right there, but when you have them, one and the other, it's very easy to lose that papilla and the gingival line becomes a problem. This person had an implant here. You can see the gray. This person was from deep West Texas. She had an implant and she's got a high lip line. See, I'd be more inclined to put a bridge in if a patient has a high lip line and a missing tooth in the aesthetic zone, because I can control the aesthetics and the gingival line with a bridge a lot better than an implant. With an implant, it's difficult to control the gingival line and the papilla. This person had a successful osseointegrated implant, but you can see the gingival line is not good and you've got dark shine through the tissue and the alveolar process. The bone is very thin often in the maxillary anterior area, and the titanium implant can shine through. And so for this woman, that was not an acceptable result. You can see how the gingival line is much higher on that tooth than this one. And you can control that better with, or at least I can, with a fixed bridge. Another one, this person has a high lip line. This is an implant. The shade's good on the teeth, but the gingival line's a little bit off, and you can see that implant shining through the alveolar process and the gingival tissue. This was a total disaster. This person was from Oklahoma and came into my practice to see what I can do for her. And I said, whoa. In this case, you want to know, where was this girl's mom when she came home looking like this? So, the person had placed the implant, had gone into the tooth, and the teeth were too tight together. There wasn't enough space, really, and gotten off of a line. So implants are not just knee-jerk, let's put in an implant. You need to consider a lot of things. This implant, this bone is often very narrow front to back, or palatal, facial to lingual. I've done small diameter implants which are less than 3 millimeters in this region. So this is not an acceptable result. This doesn't look good. What else could you do here? Well, you could possibly do a Maryland bridge. I don't want to do full coverage bridge because these teeth are so small. If you put a crown on lower incisor teeth, they become too small and they're easy to fracture. So another option would be a Maryland bridge. Putting an implant in right there is very delicate. You want somebody that's placed a lot of them, and you want to be sure there's enough facial to lingual bone. This young girl had 2 well-placed implants, but she's got a high lip line, and the gray replacing those lateral incisors. The gray titanium was shining through the gum. The gingival line is off. Now, I could have knocked a home run with fixed bridges from here to here, and you say, oh my gosh, you don't want to prep those teeth. Well, what's her objective? She wants a gorgeous smile. And I know that I can give her a gorgeous smile every time with fixed bridges. Whereas if you're missing these teeth, had a bad bridge up here, if you do it correctly, you can create gingival ponic receptor sites. The bad bridges here, and this is a bridge from here to here. If you know how to create those gingival ponic receptor sites, you can make it look real, very natural. And if the patient is just a little bit careful, just it can last a long, long time. But you don't want to do something just because that's the knee-jerk reaction to do it. And implants in the aesthetic zone can be a disaster. You see the dark shine through and gingival line issues. The pretty tight space right there. They've got to be sure they don't damage the teeth on either side. So these are some implants that I've done in the aesthetic zone. Now I did these last two cases. And see, this gentleman's got a low lip line. He doesn't show the gingival tissue. That to me is first and foremost. And he's missing this tooth. So he's got a low lip line. This is the largest smile he's got. He had a flipper in here. And so I've replaced it with this implant. There's several things working for us. He's got a low lip line. He's a guy. With this, I mean, there's a little difference between that tooth and that tooth, but he's not, his teeth are not perfect. And so you've got that working for you. But I'm not worried about shine through any of that because he's got such a low lip line. And this is that implant. Here's another guy. We lost this tooth, and here's the implant. Now this gingival line is different than this gingival line. So if he'd had a high lip line, we've restored his other teeth, this would have been a bridge because I could have controlled the gingival line better. But you can see he's got a low lip line, so it's of no consequence. And he's a guy. He's no rancher from out west. And so it's not like a beautiful woman with a high lip line that it's got to be right on the money. So this is very good. And implants are the restoration of choice in cases like that. So the point of this discussion is you don't just automatically place an implant every time there's a missing tooth. It needs to be thoughtful dentistry. Think about the lip line, if it's in the aesthetic zone, the width of bone, those types of things. So that's the Dental Minute. These techniques work, and they work every time.
Take your practice to the highest level with Dr. Cutbirth's online CE. Click on the link in the description below for dentistrymasterclasses.com. It only costs $20 per month, but right now you can join for just 99 cents. You heard me, 99 cents. So click below and change your life for the better forever right now.